Well, today the FDA announced it is scrapping black box warnings for many hormone replacement therapy products designed to help women dealing with uncomfortable menopause symptoms.
For more than 2 decades, the American medical establishment turns its back on women. Millions of women were told to fear the very therapy that could have given them strength, peace, and dignity through one of life's most difficult transitions, menopause. That ends today.
There may be no other medication in the modern era that can improve the health outcomes of women on a population level than hormone replacement therapy.
Black box warnings are the strongest drug caution that the agency can issue, but the FDA's commissioner says they have, quote, inappropriately scared women off of this kind of treatment. Joining us now is NBC News health reporter Aria Bendix. So, Aria, what were the restrictions that were in place for these menopause treatments, these estrogen replacement treatments, and why do health officials say that these benefits now largely outweigh the risks?
Right. So as you mentioned, Vicki, these therapies carried what's called the black box warning, which appears on the packaging of medications that have severe risks. Now, the reason for that actually dates back to a clinical trial in 2002 that found an elevated risk of breast cancer, heart attack, and stroke. But the trial was skewed towards older women, and it actually looked at a formulation that isn't really used today. Our understanding now of the risks and benefits have changed. So health officials say the formulations we currently use are quite safe, don't carry the same risks, particularly when they're prescribed to women under age 60, which is the FDA's recommendation, Vicki.
What exactly is hormone replacement therapy, Aria? I mean, what sort of it does it consist of, and is it only used to treat menopause?
Right. So as women go through menopause, they see a decline in the hormones estrogen and progestogen. So hormone replacement therapy is a supplement for those hormones. It usually comes in the form of a pill, a patch, a gel, a cream, and there's some preliminary evidence it might help slow cognitive decline, reduce the risk of heart disease. The FDA commissioner mentioned both of those at today's announcement, but we need more studies to confirm that. Right now, doctors primarily prescribe it to treat those common menopause symptoms that we know, like hot flashes, mood swings, and trouble sleeping, Morgan.
You know what, Aria, there's such a bigger conversation around menopause. I mean, a few years ago, we never would have been talking about it on a news program like this. So that is the good news. What should women ask their doctors about, especially now that these black box warnings have been removed? You know, what's the conversation around menopause and some of the things women should be talking to their healthcare providers about?
Right. So the concern with these black box warnings is it would make doctors potentially more fearful of prescribing these medications and make women more reticent to take it. The idea here with this announcement is to reduce the stigma so it could potentially expand uptake and access. And these can be really beneficial medications for women who are suffering with menopause symptoms. So obviously talk to your doctor if it's right for you, but this should give both the doctor and the patient some reassurance that they didn't have previously.
Sorry, can I just underscore what you just said there, Aria? I mean, essentially then, does removing the black box label make it easier for more women to buy these products or get a prescription for them?
Right. So it's not necessarily that these medications were tough to get before. Doctors can and do readily prescribe them. The idea, though, is it's changing our perception of these medications, which since the early 2000s has really been, focused on the early trial results that we just know don't hold up these days.
Wow. Aria Bendix for us with the latest and greatest reporting. Aria, thanks.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.